Hey everyone, welcome back to another video. In today's video, we're going to be talking about a common foot condition known as plantar fasciitis. If you've been experiencing pain in your heel or the bottom of your foot, you might be suffering from plantar fasciitis. Let's explore what it is, its causes, its symptoms, and more importantly, how you can manage and deal with this condition. Plantar fasciitis is often known as an inflammatory condition of the plantar fascia, which is a thick band of tissue that runs along the bottom of your foot, connecting your heel bone or your calcaneus to your toes. While this is the common explanation for it, the most recent research actually shows that while it does exhibit some inflammatory symptoms, plantar fasciitis is actually caused by collagen degeneration. As such, it is more appropriate to refer to it as plantar fasciosis or plantar fasciopathy. But most of the time, you'll still hear this condition referred to as plantar fasciitis because that's what it's been known as for such a long time. For the purposes of this video, I'll also just stick to calling it plantar fasciitis for the sake of clarity. The plantar fascia acts as a shock absorber, supporting the arch of your foot and absorbing impact when you're walking or running. With that in mind, let's get into how you might usually injure the plantar fascia. Usually there are several factors that can contribute to the plantar fascia being injured. The primary one though, and the one that we usually look for, is a repetitive or an overuse injury. So what I mean by overuse is that it would be a relative overuse, which means that if you're someone who spends the majority of your day on your feet because of your job, for you to develop plantar fasciitis, you would usually have to have a factor where you spend a lot more time suddenly on your feet, for example, doing a lot more overtime because it's suddenly gotten a lot busier, or for example, an office worker who's usually sitting deciding that they want to get fit and starting to run a 5-kilometer run every other day. That would be a relative overuse. So these are some of the common examples of how someone might develop plantar fasciitis, and if you've got plantar fasciitis, you might resonate with one of those. There are more niche reasons as well that can cause plantar fasciitis, such as trauma to the heel, landing on it very hard or falling, or an imbalance in weight distribution through the body that could result in more weight being distributed through one foot. This would obviously have to be checked by a health professional or a physio, but I've often seen this in my patients who might not fit that criteria of having a sudden increase in activity, but they have developed plantar fasciitis, that they actually have a weight distribution imbalance. Some of the other contributing factors for plantar fasciitis would include tight calf muscles, tight foot muscles, poor foot biomechanics, improper footwear, but I would generally classify these more so as factors to consider when managing plantar fasciitis rather than the sole cause. Now let's talk about the symptoms of plantar fasciitis. The classic symptoms would be pain at the bottom of the heel, right where the plantar fascia connects to the calcaneus, and sometimes this runs up into the arch of the foot as well. Now this pain is generally there worse in the morning, especially the first couple of steps after getting out of bed, but then it will usually ease off as you move around and warm up, and then as the day progresses and you are on your feet a little bit more, the pain will start to come back, and of an evening it's usually bad again. People might also feel pain after some periods of inactivity. So for example, after sitting for an hour or so, getting up and getting moving again is often difficult because of the pain. Or obviously after something like a long walk or a long hike with use, the plantar fascia will generally hurt more as well. So these are all very normal when we're seeing someone with plantar fasciitis. So how can you manage or prevent plantar fasciitis? If you've already started developing symptoms, the next couple of tips will be more so for you. For prevention, we'll come to that towards the end of the video, so stick around for that one there. There are a couple of ways to help ease symptoms if you are experiencing plantar fasciitis. The first tip would be freezing a plastic bottle of water and then using that as an ice bottle to roll under your arch and under your heel for about 15 to 20 minutes of a nighttime, especially after you've had a long day on your feet. The ice is generally good for pain relief, and the hardness of the bottle is generally good to stretch and to roll out the plantar fascia onto. Aside from the ice, the other thing to mention with this tip is that relative rest is required. And again, I use the word relative because Total rest is usually not the best for everyone, as people still need to work and be able to get around. But relative rest from any activities that would be aggravating your pain is required. So any sort of long form of hikes or walks will probably be out of the question until your pain is more settled. And so secondly, incorporating some stretching exercises into your exercise routine is usually really helpful. Stretching both your calf muscles and your plantar fascia are quite important. This usually helps alleviate tension and improve flexibility. Usually the less tension there is, the less strain and the less pressure there will be on your plantar fascia when you're standing or walking. There are a couple of ways to stretch your calf muscle. For a less aggressive way, you can use a towel sitting at the end of a bed or off a chair to hook your toes and to pull them gently up towards you until you feel a stretch in your calf. There are two versions of this stretch, one with your knee straight and one with your knee bent. This will help stretch the two calf muscles that are in there. One is your gastrocnemius and one is your soleus. And to stretch your plantar fascia, and place your affected foot onto the other knee and use one hand to pull your toes up on the affected foot. You can use the other hand to run a finger down, up and down your plantar fascia to gently massage it, or to hold onto your heel and pull it away from your toes to allow for some stretching of the plantar fascia. Thirdly, invest in some supportive footwear. Look for shoes that offer a good arch support and a good fitment around your foot. While you're suffering from plantar fasciitis, I'd suggest avoiding really flat shoes or heeled shoes because they offer a lot less support than ones with arch support, and it usually puts a lot more strain on your plantar fascia. And if you have recently changed your footwear around the time when your plantar fasciitis began, this might actually be a contributing factor to why it had started. So one thing you can try is to test, if you still have your old shoes, to bring them back out and to wear them instead for a week and see if your symptoms start to ease. One other thing you can do is to bring your newer pair of shoes with you to the physiotherapist when you get assessed, and they can often help work out whether this pair of shoes is the right one for you. On the other hand, if you have older shoes and they are starting to wear out and the support in the arch is diminishing, it might be time to look for a new pair of shoes. But just keep in mind when you're shopping around to look for ones that have some good arch support. Another thing to consider is to give your plantar fascia some external support, whether that's from rigid tape or some compression socks. Rigid tape can often reduce the strain on your plantar fascia and give it the chance to heal, especially if your job requires you to be on your feet a lot of the time. I'll leave an image of what the plantar fascia taping that I do looks like in the video, but I won't be demonstrating how to do this in this video. If that's something you'd like to see, leave me a comment down below and I'll get around to making a video on that for you. The tape isn't too difficult to do by yourself, but I'd recommend only leaving it on for about 2 days, as the rigid tape glue can react to your skin. And if it does get red or itchy, if you have tape on, take it off straight away. So the other option is to look at buying some plantar fascia compression socks, such as these FS6 compression socks, which I'll show in the video now. They will act like tape and offer some support for your plantar fascia. It's often a little bit more of a long-term solution, as you can keep it on for a lot longer. They often don't provide as much support as the tape does initially because the tape can be fitted on quite tightly. So I have had some patients who found that the tape was a lot more helpful than the FS6 socks, but some people who have had more chronic symptoms can benefit from these socks. And so lastly, prevention is always better than the cure. And when we're talking about prevention for plantar fasciitis, we're really talking about getting your calf and foot muscles strong enough to allow for adequate support and strength for any activities that you might want to do. And so that means that you want to be gradually strengthening or looking to strengthen your calf and your foot muscles. I will leave a link in the description of the video to another video that I've done that talks about preventing ankle injuries through strengthening exercises. So there'll be a couple of exercises you can look at doing there to start off with. And while exercise is the key to prevention, it's also the key to recovery. So if you are suffering from plantar fasciitis, exercise is also the way to go for you. However, your road will look a little bit different as you're looking to rehabilitate your plantar fascia after it has been injured already. And so you're looking at gradually loading your plantar fascia. And so I'll quickly talk about some key tips for that. And so if you're looking at starting your rehabilitation exercises, progress gradually. Starting a new exercise program can always inflame the plantar fasciitis, or rather re-injure the plantar fasciitis if you go too aggressively. And so you want to give your body time to adapt. And part of the research nowadays is to look at building your plantar fascia load by doing calf raises at varying speeds. And you can see how to do calf raises on the other video, but you want to build in a speed component to that by pushing off faster and lowering a little bit slower to allow for the plantar fascia to adapt to the quick contractile forces and also explosive forces. The other thing with gradual load is to think about duration as an actual load as well. So if you are looking to start walking again and you want to start with you want to aim for an hour, I wouldn't start with an hour, maybe start with 20 minutes and see how your plantar fascia responds. You're looking for no aggravation of your symptoms, and that means no aggravation at the time of exercise, after exercise, or the morning after. And if you tick all three of those boxes, that load that you've subjected your plantar fascia to is very safe. If any one of those boxes don't get ticked, so you get pain after or during or the morning after, that means that the load you've subjected your plantar fascia to was slightly too much and you have to adjust it. And so if 20 minutes is too much, you might drop down to 15 to start with, and you can test again to see whether that is a safe option for you. Week by week, you can add on 5 minutes at a time or every other training session. So maybe after 2 or 3 times of doing 15 minutes, you can start trying 20 again. Again, once you increase, you want to check whether that aggravates your plantar fascia or not. The same principle applies for any strengthening exercises. So the ones on my other video with calf raises or hopping, you want to go through the same tests with that. In saying all of this, if you are suffering from ankle pain or heel pain, it really is best to consult with a health practitioner or a physio so that you can get assessed and get a tailored program that suits you, depending on what your starting strength is, how long you've had those symptoms, or what may be contributing to them. They can help work that out with you. And so that concludes our video on plantar fasciitis, or better worded as plantar fasciosis or plantar fasciopathy. By understanding its causes and recognizing its symptoms and understanding how to manage and prevent them, you're taking good steps towards looking after your foot and your health overall. Once again, if you have enjoyed the content of this video or you found it helpful, please do hit that like button and subscribe to my channel. It really does help out my video and I really do appreciate it. Thank you for watching, and I'll see you in the next video.